I became involved in this area of research in 2009 when my colleagues and I published a meta-analysis of the research on tumor risk and mobile phone use. And we found that in the higher quality studies, which had no industry funding, we found an association between long-term mobile phone use and brain tumor risk, specifically brain cancer. This generated a considerable amount of media attention and intrigued me in the subject area because I'd known virtually nothing about this research prior to doing this meta-analysis. And I began to wonder why there was so much misinformation or ignorance about this whole topic. And I soon discovered there was essentially no funding to do research on this topic. So I began to follow the research that was largely being conducted in other countries and translating that research and disseminating it to whatever audiences were interested in it. And since 2013, I began to report on much of the research and policy developments on a website known as Electromagnetic Radiation Safety, or saferemr.com. And so I have a limited time here today. I'm going to talk about some of the policy developments I've been most associated with, but there's much more detail on my website along with lots of research summaries. In 2011, 7 years ago, the International Agency for Research on Cancer convened an expert working group, 31 of the leading experts on radiofrequency radiation and health. And this expert group came to the conclusion that radiofrequency radiation should be classified as possibly carcinogenic to humans. And it was largely based upon evidence of increased risk for brain cancer among wireless phone users. Strangely enough, the WHO has hardly changed its position with regard to radiofrequency radiation since 2011, and very few governments have taken this information very seriously in terms of changing public policy. In 2015, I was an advisor with a group of EMF scientists that put together a petition that was signed by 190 EMF scientists, all of whom had published peer-reviewed research on EMF and health or biology. And this petition called for precautionary health warnings and stronger regulation of electromagnetic fields, specifically non-thermal exposures, not just thermal exposures, which is all we're currently being protected from. As of this year, we now have 237 scientists who have signed the appeal, representing 41 different nations. And a recent count I did of EMF publications in professional journals found 2,000 papers and letters to the editor published by these 237 scientists. The US government has basically taken a wait-and-see attitude. It demands conclusive evidence, and yet, on the other hand, it has hardly funded any research. The only exception being the National Toxicology Program study, which the FDA called for in 1999, and we still don't have final reports at this particular time. The recent peer review, though, did declare that the study found clear evidence of a very rare type of heart cancer in male rats, and some evidence of other types of cancer and other kinds of effects in rats and in mice. Also, evidence of DNA damage in both rats and mice. Several governmental agencies have criticized the FCC and the federal government's role in this. The FCC is the regulatory agency over RF or radiofrequency radiation. The U.S. Department of Interior, for example, in 2014, in a submission to the FCC, claimed that the RF exposure guidelines were now nearly 30 years out of date and inapplicable because they only controlled for thermal heating. The cities of Boston and Philadelphia also basically accused the federal health agencies of negligence. Pass the buck attitude was the language they used in their submission. The World Health Organization and federal health agencies and federal regulatory agency websites all contain language which tends to minimize the perception that there's any risk from radio frequency radiation. Here are some direct quotes that are still appear on these websites. And you can see you have to really parse the language closely because the statements are in large part misleading or completely inaccurate. And in part, I think this is because the few experts that we had in the federal health agencies have long ago left these agencies or either by going to industry or by retirement. And so we're in a situation where essentially the blind is leading the blind with regard to our federal health agencies. The FCC, which is the regulatory agency over RF radiation, has been captured by industry according to a detailed investigation by Norm Alster, a career journalist who spent a year at Harvard, has published a monograph called Captured Agency, How the FCC is Dominated by the Industry it presumably regulates. The FCC depends upon various federal health agencies, especially the FDA, for information about the health risks of radio frequency radiation. But as I said earlier, these agencies really have essentially no expertise left, and they tend to rely on scientists who have strong industry ties to provide them with insight about the current state of the research. There is an radio frequency interagency work group, but over time that became dysfunctional. It never had any real authority. I interviewed a number of members of that group several years ago and found that they only met through teleconference, 1-hour teleconferences 3 times a year, which is hardly enough to keep abreast of the research. And they didn't report to any superiors. What they found, there were no minutes kept of the meetings. So it's basically a sham organization that gives some cover to the FDA and the FCC that they're keeping abreast of the research. A number of agencies and organizations have called on the FCC for policy changes. The FCC collects input, but then doesn't do anything with this input. And so as a result, the radio frequency exposure guidelines don't ever change, and the industry gets to proceed in its merry way. For detailed information about how the industry has manipulated the public policy over the years, an excellent website is Microwave News, edited by Louis Slesson, who's been covering these issues in this industry for more than 35 years. And a recent report in The Nation, although not totally accurate, does a pretty good job in exposing how the wireless industry, particularly the telecom industry, has made us believe that cell phones are safe by manufacturing doubt, essentially following the same playbook that the tobacco industry used successfully for decades. The telecom industry and the military has been also engaged in this campaign at various times, especially in the early years. The trade organization for the wireless industry is the CTIA. They typically work behind the scenes, manipulating the positions of federal agencies and the FCC, and then hide behind the statements that those agencies make. I think it's because their lawyers had told them not to make direct statements, because that would just increase their liability when these product liability lawsuits finally appear before a jury. In 2010, during this period, about a half a dozen states and numerous cities around the country tried to pass cell phone right to know ordinances, basically trying to make their residents aware that they should take precautions with regard to cell phone use. And a number of ordinances and state laws were put forward, but the CTIA was successful in virtually every case in killing off those laws. However, San Francisco did adopt a cell phone right to know ordinance. The CTIA filed a federal lawsuit right away. The courts took some issue with regard to some of the health concerns raised in the warnings that the city wanted cell phone retailers to post. And so the ordinance was revised, but the CTIA then, and the federal district court actually approved of the law, but the CTIA appealed to the Ninth Circuit Court, the Federal Appeals Court, which overturned the lower court's decision in an unpublished opinion. The appeals court wanted the case to be sent back to the district court to be resolved. But at that point, the San Francisco Board of Supervisors no longer wanted to pursue the law, and so they basically disbanded with the law, and that was the end of the San Francisco law. The city of Berkeley at that time was also considering adopting a cell phone right to know ordinance, but didn't want to get involved in the lawsuit. However, when it saw what happened to San Francisco, the city felt that it could learn from that, and the city proposed a law that was much narrower and much more modest in its intent, which would require cell phone retailers to post a warning about the RF exposure and not address the health risks per se, because the court seemed to take issue with that since the federal health agencies haven't recognized the health risks. This law was adopted in 2015. The CTIA once again filed the federal lawsuit. The city, based on the court ruling, stripped off one sentence that focused on the exposure to children. The law actually took effect. The judge approved of the law. The law took effect 2 years ago. In the meantime, though, the CTIA has appealed to block the law, and the appeals court turned down the CTIA. So the CTIA is currently appealed to the U.S. Supreme Court. And we should hear probably within the next few days whether the Supreme Court will take the case. So I suspect that the CTIA will pursue the litigation and go back to the district court if the Supreme Court turns them down. So that issue is far from over. And here's what the actual notifications that the city of Berkeley wants its residents to see. And this is posted in the cell phone retail stores in the city currently, and has been for the past 2 years. In 2009, the California Department of Public Health drafted a cell phone safety guidance document, which has been suppressed for 8 years. In 2014, I was tipped off by a wireless safety advocate, submitted 3 public records requests. These were all denied. In 2015, the New York Times, Wall Street Journal also submitted public records requests because I tipped them off. Those were denied. 2016, the UC Berkeley Environmental Law Clinic and the First Amendment Project filed a lawsuit on my behalf, a pro bono lawsuit. We won that case a year ago. The court forced the department to release the draft documents of this cell phone guidance document. There were 27 versions of it released. In December of last year, the CTIA published its final guidance document. This was not required by the court, by the way. Here's what the document looks like. It's a 3-page document. It can be downloaded from the CDPH website. It's in the public domain. Every city and county and state, for that matter, can now disseminate this document should they so desire. This is arguably the strongest statement made by a public health agency in the United States to date. with regard to the health risks, as well as with regard to potential ways to reduce one's exposure to cell phone radiation. The latest threat to the population and to population health and environmental health is 5G. This was mentioned by, I think, both of the earlier speakers. This is the 5th generation of cellular technology. I have a number of posts on my website that address what 5G is and what the potential health effects, particularly of millimeter waves, but there's also low band and high and mid band frequencies that are being used for 5G. Other good websites, and the links are here, are the Physicians for Safe Technology and the Environmental Health Trust. If you want to get up to speed on the 5G issue, a group of 200 scientists have signed a petition calling for a moratorium in the European Union on the rollout of 5G. This was submitted to the European Commission. The Commission denied the request. And most recently, the International Society of Doctors for the Environment also submitted an appeal that there be a moratorium on 5G. The US member organization is Physicians for Social Responsibility. So I've covered a number of policy developments. There's a lot more one could discuss had we the time, with regard to cell towers, Wi-Fi in the schools, smart meters. There's been a whole host of attempts at policy, but the industry has been very successful in pushing back efforts at the local, state, and federal level to date. So what is really needed is a membership organization along the lines of Americans for Non-Smokers' Rights. I think that would be a good model to deal with wireless safety issues and provide technical assistance and support to the many communities around the country who are fighting wireless safety issues. So I'll leave it at that, and so we have some time for questions.
Thank you very much. I want to respond to some of the questions that have been posted on the Q&A section. I've reviewed them, and there seems to be a couple of questions regarding exposure limits in the US, and I want to open that up to all the speakers here to believe if you would state whether or not you think the federal agency or state and local government public health exposure limits are sufficient currently, or what should happen?
Well, as I said in my lecture, the belief of many scientists, EMF scientists, is that the exposure levels are completely inadequate and need to be substantially revised. But let's hear from the other speakers as well on this.
I think something needs to be done with respect to long-term low-level exposures, which is simply not in the standards at all. So something along in those lines, whether it becomes advisory or no one deals with it, I think takes longer to debate than we have. But I think something with respect to long-term low-level exposure data and information ought to be shared much more widely.
Can I saw a question, Tony, I don't know how you wanted to measure. I saw someone ask that for me to correct the statement, high frequency EMF study was not as, has more study done in the low frequency. Shall I make a clarification here?
Sure, go ahead.
Yeah, what I talk about is epidemiological studies. So in the low frequency study, since the whole EMF started with low frequency, we have many, we're talking about human studies, epidemiological studies, looking at all kinds of outcomes. So in comparison to high frequency, basically that's called the cell phone frequency. So cell phone frequency only study I'm aware of are done with biggest is interval studies. So those are study outcome basically is only one outcome. I mean, nowadays they have some studies coming out to look at also child neurological development. Mostly is about brain cancer. And as I said before, those studies largely made a conclusion there's no association except they didn't really measure cell phone frequency back 25 years before the cancer occurred. So that's what I'm talking about. I'm not talking about those animal studies, in vitro studies, in vivo studies, all those. I'm talking about the human studies because that's what the study, all the federal agencies, without getting into too much of a how risk assessment is done by the federal agencies. That's what they are relying on. So as Joe indicated right now, all those federal agencies in the United States anyway, all those agencies refuse to claim there's any effect is because they are usually using argument about you don't have enough human studies to show that. The animal studies, they pretty much can be used as a confirmatory. They cannot be used if you don't have a human study show the association. They're not going to, federal agency is not going to take it. That's what I'm talking about. I'm not talking about this in vivo, in vitro, or the animal studies. Okay, hopefully that clarified that.
Great. We have one other question from Dr. Raymond Nutra. I wanted to see if you saw that. It says, will you be publishing on the interaction between high typical day exposures and the measurements you have on the dirtiness of the subject's home EMF?
We look at the dirty. I think I emailed Raymond before. We can talk about more detail. That's totally different subject in terms of the hypothesis different, measurement is different, whatever the underlying mechanism is different. I thought I sent Raymond before about some preliminary result in the context of dirty electricity, but if he wants more idea and more, we can certainly talk about this privately.
Yeah, I'd like to follow up on DeKoon's response to the prior question. We also have a series of studies done by Hardell showing up to a threefold risk for 25 years of wireless phone use. And we have a study out of France, the Serenat study, showing increased brain cancer risk for long-term cell phone users and heavy cell phone users at even lower levels than the Interphone study. Plus, there's been a number of subsequent Interphone papers, almost all of which are showing much stronger effects on brain cancer than the original pooled paper reported. So there is a substantial amount of evidence for carcinogenicity, cancer effects in humans from epidemiologic case control studies. There's also a fair amount of a similar number of studies showing effects on acoustic neuroma, a non-malignant tumor in the brain. These are all reported on and summarized on my website. For more information, see at saferemr.com.
Thank you. I also wanted to move to the idea about best practices. And one of the questions says, what's the best resource for how to avoid EMF? Or what, we had some other questions on best practices. Do you have any suggestions, any of the speakers?
Yeah, well, I have a safe tips page on my website, and so I have tip sheets, including the California Department of Public Health tip sheet. There's a number of measures people can take. My own tip sheet is there as well, so I suggest people take a look at that for various sources of safety tips.
The bottom line actually is you just remember distance is your friend in this case, without getting into too much in the details. Yeah, I think those websites, and also actually NIEHS has very good website, even though they don't establish a relationship, but they do have where the sources are and how to avoid that.
I'd like to come back to this thing is that you can expect to see both positive and negative effects, and there's very good evidence that we can, in some cases, prevent the growth of cancer with pulse magnetic fields. So you've got both things got it going in both directions, and you need to sort that out. So I think that's part of what has to be taken into account in this thing, because you're going to see both kinds of results and you're going to see no results. These are all part of what you should expect. No.
Yeah, also I want to emphasize from a helicopter point of view of this whole EM health effect is right now what we need to change is the very sick perception that EMF, not people here probably, EMF doesn't have biological effects. If we can persuade the public and policymakers or scientific community that EMF doesn't have biological effect, then the further research, in my opinion, will follow. Because right now the people have such a dismissive attitude for whatever the reason, some of I alluded in my talk. We need to change that. Ultimately, we need to stimulate, hopefully, more research in this area.
I concur on that.
I fully concur on that. And we also need to stop the deployment of new technologies and exposure to frequencies and types of modulation and pulsing and beamforming that are essentially is a massive experiment on the population, not knowing what the outcomes are going to be. It also affects plant life, animal life, and microorganisms, these frequencies. And so it's really taking a huge risk with the whole entire planet by rolling out 5G with all these different frequencies and putting millions of cell phone antennas in the US and around the world that don't exist at this current time.
I would think that it would be very hard to decide when you've done enough research to say that this either does or doesn't do something. And I expect the effects will be time dependent, and sometimes you'll see something, sometimes you won't. Certainly, depending on which way 5G goes, you're going to get different physics, different absorption depths, and probably different exposure type results. So I expect you'll see a lot of different things if you go to different frequency bands, particularly if you go up into the millimeter wave band where the absorption depth is very short. Most of what you will see will be within a few millimeters, or maybe even less than that, depending on the frequency of the surface of the skin.
The research on the millimeter wave suggests that the effects will be primarily on the eyes, the testes, the skin, the sweat glands, and the peripheral nervous system in humans. But we may see some profound effects on microorganisms. There's some evidence to indicate that certain species will become antibiotic resistant with exposure to millimeter waves. And it will have some profound effects on certain insects, depending on their size. So I just think it's not prudent to just roll out this technology without any idea what the long-term consequences are for our species and other species.
And just a point of clarification that millimeter wavelengths are 5G, correct?
In part, they will be using these high bands from 27 gigahertz up. They'll also be using low bands around 500-600 megahertz and mid bands roughly 2.5 to 3.5 gigahertz. So it's going to be a combination of frequencies as this gets deployed. Frequencies that have never been used before for large commercial applications. They've been basically reserved for very special applications. So not many people have been exposed to them en masse.
Well, I want to thank everyone for both attending and for all of the presentations. Thank you very much. Maria, do you want to come back in?
Yes, thank you so much, Tony. We are approaching the end of today's webinar. A video recording will be available on the CHE website soon, and tomorrow you will receive an email containing a link to the recording. CHE's next webinar from the CHE EDC Strategies Partnership will take place next Wednesday, May 16th, and is titled, Does Early Bisphenol A Exposure Cause Hyperactivity in Children? A Systematic Review. You can RSVP through CHE's website, healthandenvironment.org. If you are new to CHE and would like to stay updated about upcoming events and more, please sign up to receive our newsletter by selecting the Join Us tab at the top of any page on our website. Additionally, if you appreciate these CHE Partnership webinars, bringing you the latest environmental health research for free, we encourage you to support CHE's ongoing work by making a tax-deductible donation via our secure website. Again, our website is healthandenvironment.org. With that, I would like to thank our speakers for taking the time to present today and Tony for her excellent moderation. Thank you so much for joining us and have a great day.